We want to turn now to the fight against the coronavirus. Michigan Governor Gretchen Whitmer is urging the White House for more vaccine doses.
We are seeing a surge in Michigan, despite the fact that we have some of the strongest policies in place, mask mandates, capacity limits, working from home. We've asked our state for a 2-week pause. So despite all of that, we are seeing a surge because of these variants. And that's precisely why we're really encouraging them to think about surging vaccines into the state of Michigan. And I'm going to continue to fight for the people of Michigan.
Right now, the state is the epicenter of the pandemic, second only to Florida in cases of the UK variant. The White House says it's not prepared to increase vaccine supply, but is willing to send additional personnel to help the state with the current surge in cases there. This as over 4.6 million people in the U.S. received a vaccine on Saturday.
Oh, my gosh.
The nation's highest one-day total.
They're moving toward 5 million vaccines a day.
It's incredible.
That really is unbelievable.
Joining us now, former Obama White House advisor for health policy and vice provost for global initiatives at the University of Pennsylvania, Dr. Zeke Emanuel. If we could talk about Michigan and the decision to work on the caseloads of actual coronavirus cases versus trying to up the vaccine supply.
Well, as I understand it, according to the White House, there's a lot of supply, and that's not the limit. It's getting the vaccine into arms. You can see they did get 4.6 million. It's worth noting that about half of that goes to people who are getting their second doses and half of that to people who are getting their first doses. As a country, we're at about 35% of the country's gotten at least one dose. And probably to really get around this, we need upwards of 45 to 50%. The kind of percentages we're seeing in Israel and in Britain. And I think we need more shots in arms and more shots in arms of people who haven't been vaccinated.
So, Zeke, right now, you look at different parts of the country. You look at Texas and Florida, for the most part, it's wide open. I mean, they're opened up. You look, I've been talking about Boston, a lot of Boston. Other parts of the Northeast closed down. Upstate New York, I saw a picture from a high school soccer game from a friend, which is absolutely ridiculous. I mean, social distancing of like 30 yards between every parent in the stands. When do we start turning towards a more balanced approach? And I will tell you, I've got the reason I'm concerned about it is because so many mental health providers say, we understand COVID is critical, but we've got over 100 million shots in arms. We've got, 3 million, 4 million a day. We've got to start worrying about the mental health care crisis and can't be overcautious at this point about a fourth wave or a fifth wave or a sixth wave. We got to start opening cities up. I'm curious what your thought is on this balancing act as we're here in the middle of April.
Well, we certainly want to open up. And I think the fact is that is important. It's important for socialization. It's important for economics. It's important for education of students. All of that's important. We also need to get more people vaccinated. Again, we're at about 35%. We're going along. But I think we're also seeing that we're probably not getting enough people into vaccine sites. You're seeing a lot of places. The New York Times had an article on Thursday or Friday about Mississippi having empty vaccination sites. You're seeing states open up and allowing people from other states to come in and get vaccinated because there's a lack of demand. You're having not enough people. We have a lot of people who are waiting for their first dose, who really want their first dose, and it's uneven around the country. I know in Chicago it's hard to get a dose, but outside Chicago, down in Springfield, you can get a dose. In Boston, it's hard to get a dose, but outside of Boston, in some areas, you can get a dose. Same thing in Washington, D.C. So we have to get a lot more people that first dose so that after about 10 to 14 days, they're 80% immune. And that is a very important landmark. And we really, I think, Joe, your question is we got to get to about 45 or 50%, and then we're we're not at herd immunity at that level, but we can actually begin to feel much more confident and that we're really beginning to get our arms around this and we can return to normalcy. But we're not there yet.
Jonathan Lemire. Yeah, the AP's Jonathan Lemire has a question. Jonathan.
Dr. Manuel, good to see you again. You're certainly right. It's a source of some frustration for the Biden White House that there are some areas that are so desperately needing more vaccines, asking for a surge of vaccines, but yet there are unused vaccines just sitting around in a number of states throughout the country. But I wanted to get you to look a little further afield, if you could. We're seeing signs of improvement in some other countries. The UK today is lifting some of their lockdowns, but parts of Europe are really being battered by the virus right now. And certainly there's a lot of global concern about Brazil, with a skyrocketing death rate and surging case numbers and real fears there of growing number of variants. So let me ask you if you could just give us a quick assessment of the state of the virus around the globe, and how worried should Americans be that if the virus rages elsewhere, that more of that could end up back here, perhaps requiring, producing more contagious variants, requiring booster shots? How worried should we be at home as well?
That's an excellent question, and let's make 3 points. First of all, Britain is well ahead of the rest of Europe with, again, about 45 to 50% of their population vaccinated. And the rest of the Europe is down in the teens or early 20%. They made a bet on the AstraZeneca vaccine, and the delivery of other vaccines has not been as prompt. The Pfizer factory in Belgium was being redone, and so supply has been low in Europe. They are being battered by this British variant, the B117, and they don't have enough vaccine. So as their vaccination rate comes up, they should begin to do better. And as the B117 completes its spread, as it were, Brazil is a huge worry. And it's breeding variants. It's actually the Brazilian variant P1 has gone to Canada, and you're seeing outbreaks in Canada that are very severe in places they hadn't had it, like British Columbia, and that's because of the Brazilian variant that is there. And we in the United States, the third point is that we in the United States, we're not going to be immune to those kind of variants, and we need to first have the CDC track the genetic sequencing of variants much more rigorously. One of the things we have not had a national discussion about is that our testing has gone way down, and our monitoring of variants has not gone as high as it should. And so we're flying a little blind, and we need to have better information about those variants. The fourth point you suggest, Jonathan, is, look, when we're getting our vaccination rate under control, we need to begin sending our vaccines to hotspots around the globe to prevent the development of variants, to get people vaccinated in other countries, because that's where we're going to get a lot of we could get a lot of new variants, and that they could come back to this country and reignite another surge.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.